you're at home battling either bronchitis or an infection of your lungs, either viral or bacterial pneumonia, today I'm going to share with you 3 powerful resources that you can implement and deploy today that will help heal your bronchial and lung passages and reduce the mucus that you might be dealing with that's causing you to cough and have wheezing and just really great difficulty when it comes to breathing overall. This protocol is what I've been recommending with patients, and I can't wait to share this with you. I'm Dr. Melissa Gallagher, and I have been inspired recently with patients this week who have had an assortment of bronchial and pneumonia infections. These are patients that some I've had to send to the ER, and others I've sent home with this 3-part protocol. I'm sharing this with you today. It will be highly effective and impactful for your healing. Over the course of the last several years, there has been an assortment of respiratory illnesses, viruses, and bacteria that has been plaguing our lungs and our bronchial passages. These 3 tips are going to be extremely helpful for you healing your body. Number 1, I recommend that you order online a nebulizer. A nebulizer is a particular device that you actually find in the hospital, but you can deploy at home, where you put this cup over your mouth. This is a mask. This mask has the nebulizer here. So basically, this mask is going to be emitting and aerosolizing saline. This is the magic of these masks. So when we put saline in this little part right here, we use saline vials, and I will include all the links for all these items down below. You can diffuse anywhere between 3% and 7% saline in about a 12 to 15 minute treatment. You will fill up, there's certain lines here on the little nebulizer cup, and when you fill it up, you then fit it here, you put this over your face, and then you turn the nebulizer on. For the sake of today's video, I'm not going to do that, but nebulizing with intensive saline. This is saline above and beyond your normal saline spray that I recommend for head colds. We're going way more serious and way more therapeutic. If you've ever been in the hospital with a breathing treatment, the nebulizer is the main medical tool we use to depart healing substances. Sometimes it's steroids, and often the case it's going to be a combination of saline, an assortment of percentages. In this case, at home, you can order 3% or 7% saline solutions. These are hypertonic. These are hospital, professional, medical grade that you can order. Again, there'll be links down below. If you are dealing with an infant or a child, there is a recommendation to use 3%, but if you're an adult, you can go up to 7%. Some cases, I might recommend half and half the dosing to kind of level it at about 5%, but either way, you will nebulize several times throughout the day. What nebulization of saline does is it emits an aerosolized saline that we're inhaling and is going down into the bronchial and the lung passages, and it is getting in there and it's decongesting the lungs. Saline is highly effective at reducing mucus and the overwhelm of mucosal production. Saline is also highly effective at combating any type of bacteria. And where there's mucus, there will be bacteria. You can have a viral infection that turns bacterial because the virus causes an inflammatory immune response where we're creating more mucus. That harbored mucus then turns into an infection, and you are now dealing with a full-blown lung or bronchial infection. Nebulizing multiple times throughout the day is some of the best things you can do for yourself when either you are in a full-blown state or you're kind of starting to feel things getting deeper in the chest. If you have any specific questions about nebulizing or dealing with an infection at home, please comment in the comment box below. I also work with patients. I've had 3 patients just today that I've had to send for specialty care, and 2 were admitted into the ER and are going to be looking at 3 to 4 day hospital stays because they did not take action immediately. And for patients that did take action, often they're sent home to nebulize or to convalesce at home with antibiotics. This 3-part protocol will greatly accelerate your healing and get rid of the mucus so you can sleep better and heal faster. So I'm really excited to share with you tip number 2, and that is to use a nano NAC. NAC stands for N-Acetylcysteine. I've talked a lot about this in previous videos here on my channel, but NAC is our go-to for respiratory congestion, respiratory inflammation. NAC has a very specific mechanism that it works in the bronchioles and in the lung tissue. It's heavily researched. I'll include some research links down below to justify this. You can take 600 milligrams of NAC multiple times throughout the day. What we recommend is micro dosing. I say this in quotes. That means we take a decent quantity multiple times throughout the day. So we're constantly delivering effective treatment and effective healing consistently. So 600 milligrams, sometimes I'm going up to 1200 or 1800, depending on the cases, but we start with 600 milligrams every 3 hours. And you do that during your waking hours until symptoms subside. In most cases, 2 or 3 days is when you're really going to see the effect. For some of my asthmatic or patients with COPD or emphysema, sometimes it's shorter because it's that effective, but everybody's body is different. So Nano NAC is a more bioavailable, more concentrated NAC. I'm going to include a link where you can order this. You will gain free access to my patient account where you'll have access to all of the resources I have. I even have some protocols that you can download for free, and you'll get 10% off. So Nano NAC is definitely a go-to. Have it in your medicine cabinet if you often have lung issues. My third recommendation is one of the most powerful immune herbals, and for lung and bronchial and just breathing issues or problems with breathing and situations or infections that have a lot of mucus and congestion, wheezing, intensive cough, pneumonia, bronchitis, Astragalus is our go-to herbal. And there is only one form of Astragalus that is going to be the most concentrated form, and it is using the liquid herbal tincture of Astragalus. I love this so much. It's a go-to in our household. Anytime any of us get any type of cold, flu, any of the signs of respiratory issues, which most colds are respiratory infections, upper respiratory. But when we're talking about deep-seated bronchial or lung-related infections, Astragalus is a very potent resource to help the lungs heal and to help combat that immune overwhelm and the cytokine storm that's producing more mucus and more inflammation. And with any type of lung or bronchial inflammation or infection, we have to be really cautious depending on your health concern, condition, and your age. There's what we call a golden triangle, where our heart, our lungs, and our kidneys are all working together in an ideal symbiotic state. When one or more of those gets offline or infected, it's going to unfortunately have a negative effect on the heart and on the kidneys. So when the lungs are compromised, either with an infection that's bacterial or viral, or a really deep chest cold, then we need to be concerned about heart rate and blood pressure, and we also need to be concerned about potassium levels and kidney function and certain lab values that dictate a healthy kidney function. I say this because I just want to educate you, and I really want you to have resources at home so that you don't have to end up like some of my more recent patients. Currently, there are 2 types of lung infections. One's bacterial and one is viral. And I'm finding that the viral cases are landing more of my patients in the hospital that are not addressing this straight out the gate. So wherever you find yourself, if you're watching this and you're wanting to be preventative, or if you're convalescing at home and you want to recover, these 3 resources are going to be extremely impactful. And I encourage you to check out the description box where I'm going to share with you a really good nebulizer that you can use at home. This protocol is also effective for pediatric cases. The age, weight, and the kind of health background is a variable. And if you find you want to consult with me directly, I'm happy to do that. I do telemedicine appointments with patients here in the US and all around the world, and I welcome helping you recover. But these 3 tips are things you can use immediately to get you feeling better. I'm excited to share these tips, and I hope you get to feeling better. Have faith and trust that your body is going to heal. Rest and relax, and know that your body is on body time, not human time. Give your body the grace and space to heal, and I can't wait to hear how effective these treatments are for you. Thanks for tuning in. Happy holidays, and I'll see you on our next video. Okay, you need to get down.